The wheels and gears of insurance. Hello, I am Kevin Knaus, an independent health insurance agent in California, and also a certified covered California health insurance agent. And insurance is complicated. There's a lot of moving parts, just like a clock. I have a small collection of antique clocks, and it struck me that health plans are kind of like clocks. When you open them up, oh man, all these wheels and gears and levers, and they're complicated, and you don't know what different things do until you study them. But to apply the clock analogy to health insurance, I'll try and help you understand some of the mechanisms that are going on. The first one being the deductible. Now, just like clocks, health plans are structured differently. They're built differently. Not all health plans have deductibles, and not all services are subject to the deductible. But a deductible is a dollar amount that you must accumulate, that you must be responsible for before the health plan begins to share in the cost of the healthcare service or the equipment or even potentially prescription drug medications. Again, now not all services or drugs are going to be subject to a deductible. You may go straight into a coinsurance percentage or a copayment, but that's what the deductible is. You have to accumulate a certain amount of dollars that you need to pay before the health plan begins to pay. So an example, a $5,000 deductible, and perhaps you have met that because you have been hospitalized. Then you would go into coinsurance. But what's important with the deductible is that it adds to meeting your maximum out-of-pocket amount, that MOOP, which we will get to. So you've met that deductible and you go into coinsurance. So what is coinsurance? It's a percentage. It's a percentage of the next dollar of healthcare services that you have paid for that you are now sharing with the health plan. And that percentage can be 10, 20, 30, 40, or 50%, depending on the health plan. So, and again, not all services may be subject to the deductible. You may go straight into coinsurance for some healthcare services or prescription medications. One example, you've met your deductible if it is applicable, and the health plan has 40% coinsurance. And then you have a service that costs $1,000 and is subject to the coinsurance. That means you're going to pay 40% of that $1,000 or $400. And the health plan is going to pay $600. So that $400 you pay, that goes towards meeting the maximum out-of-pocket amount. Now, some services, drugs, are just subject to a copayment. And a copayment is a set dollar amount. It's not based on what the cost of the service. It's not based on a percentage. It is always a fixed amount for that service every time. And it will also add towards meeting your maximum out-of-pocket amount. An example are primary care visits. When you go to see your doctor, in many health plans, it might be a set $50 copayment. Now, you haven't met any deductible or paid any coinsurance, and you may see your doctor every other week, and it will always be $50. So what is happening like a clock is that the health plan is keeping track over time of everything you spend. And with a clock, there's this little wheel that we call the escape wheel, and it's kind of attached to this little anchor and a pendulum, and it allows the time to escape. It allows the clock to unwind. And hopefully you get to a point where you have met any deductible, you've paid coinsurance and copays, and bing! You have met your maximum out-of-pocket. Now, the maximum out-of-pocket is a set amount attached to the health plan, and it is your maximum liability for healthcare services and also generally prescription medications on the individual and family plans. And once you have met that, The health plan pays for everything 100% for the remainder of the year. So one example, let's say your maximum out of pocket is $7,000 and there is a deductible of $5,000 within the plan, and you had to go to the hospital and have surgery, so you met that deductible of $5,000, and then you went into coinsurance for the additional amount of that hospitalization and you paid $1,200. And then over the course of the year, copayments to see your primary care physician, specialists, and other copayments and prescription medications may equal $800. So we total all those up, $5,000, $1,200, $800, and boom, you've met your maximum out of pocket for the year. Now, not everyone is going to meet that MOOP every year. Some people will do it in the first month. And that's kind of the, that's kind of the roll of the dice. But how does this look like when you go to the summary of benefits, when you open up the clock to look at all those wheels and gears? Well, on this particular summary for a potential health plan, the deductible is $5,400 for an individual. We go down to covered services and benefits. We can see physician services, outpatient facility, maybe you're having a little outpatient surgery, 30%. Now, I put a question mark under CYD, calendar year deductible, because again, some plans require you to meet a deductible before you go into that 30%. Other plans in certain services, you go straight into the coinsurance without meeting the deductible. Down below, we can see other routine services. Primary care office visit is $50. Specialist is $90. Those are set copays, regardless if you've paid anything towards meeting a deductible or coinsurance. But when all that adds up, right at the end, bing, $8,700 is the maximum out of pocket for this health plan. And that's when you get to escape all additional healthcare costs. So all this stuff is confusing, and it takes time to learn the deductible when it comes into play, coinsurance, copays, and that maximum out of pocket. And every time I open up a clock, it's like, this doesn't look the same as I looked at it last time. But if you have any comments or questions, you may leave those down below, and I will do my best to answer them. So may all of your clocks be running well, keeping good time, and strike properly on the hour. For InsureMeKevin.com, I'm Kevin Knaus.